Good evening. This is Dr. John Littell. I'm coming to you tonight to discuss what's probably the most important issue facing all Americans today. And it's not just COVID-19 as in my previous videos, but it's actually the manner in which we are continuing as Americans to be bombarded by the news media with these numbers of cases and numbers of deaths. One of our local clergymen came up to me just today and said, Dr. Littell, what's up with all these numbers in Florida? Are we not doing a better job with COVID-19? And I said to him, guess what? The increasing cases in the state of Florida and other states is good news. That's good news. And he looked at me in a very puzzled way. I said, you know, it's good news because what we're finding is that so many people who are not symptomatic are flocking to the health departments, even in our own community here, where they have signs up that say free testing with or without symptoms. And so what happens is folks have been curious. Is it possible that I've been infected with COVID-19? And they go there and they get typically the nasopharyngeal swab, and it may come back positive in a certain number of cases, and they say, guess what? You are now a case of COVID-19. So picture this. You've got perfectly healthy people, perhaps some are in the healthcare profession, paramedics, nurses, doctors. Others are just curious. They want to know if they can travel to see their loved ones, so they want to know if they've got COVID-19. So they either go and get this nasopharyngeal swab, which detects the actual antigen or a component of that protein part of the virus, known as nucleic acid, and that has a certain amount of high sensitivity, meaning that it's not 100% effective at telling you that you're positive or negative, but it's fairly good. And so if it comes back positive, regardless of whether you had symptoms, now you have that case, a new case. Similarly, you can get a blood test, a serological test, which checks for the antibodies. If that comes back positive, voila, another case of COVID-19. And you may ask, you know, why are we doing it this way with COVID-19? I'll tell you what, I've been a physician over 30 years. I've taken care of patients with measles and mumps, with malaria, with tuberculosis, with HIV/AIDS, with influenza, and recently now with COVID-19. The difference with COVID-19 and all those other diseases has been with those diseases, the patients were actually sick when we gave them the diagnosis of a case. So for those of you who are old enough to remember when we'd had scarlet fever, diphtheria, polio, pertussis, if a child in a family was diagnosed by their doctor with a case of one of those diseases, that child was quarantined. They literally would put tape over the doors of their bedrooms and keep the other children away from that child and hope and pray that that child survived. That was a case of a sick person afflicted with a disease that may or may not kill them. So when you hear the term case, when most Americans hear that so-and-so has a case of COVID-19, or that we've now exceeded 1 million or 2 million or 10 million cases of COVID, whatever it ends up being, people are panicking. And guess what? That panic is not necessary, it's not justified, but it's intended. And that's why I make these videos, to let you know that from a medical reason, from a medical perspective, an objective scientific perspective, there's no reason to be concerned when perfectly asymptomatic healthy people are being told, hey, guess what? You have evidence that you contracted this cold virus, coronavirus 2019, COVID-19. You know, we never did this before with influenza. When we had H1N1, we didn't go around doing mass testing, despite the fact we had tens of thousands of people succumb to that, including many more young people than have ever succumbed to COVID. And I took care of many of those patients. You know, it's concerning to me that at this very point in time, most of the hospitalized patients in my own community with COVID-19 are there because they've tested positive in the nursing home setting, and they're not allowed to return to the nursing homes until these tests become negative, which can take a long period of time since these are new tests. and we haven't quite figured out how to interpret them. I'm sure many of you have seen front page headlines even today in your local newspapers stating how inaccurate many of these tests have been. We've got false positives, false negatives, true negatives all over the place, people flocking to get tested, and we don't know what to do with the positive test. I discussed that in my last segment on vaccines and lab testing. So again, understand that the definition of a case of COVID-19 is radically different than any definition that I've ever dealt with as a physician. And why is that? Well, there's the document. Here's the document. This document came out in April of this year. It's from the Council of State and Territorial Epidemiologists. And back in April, specifically on April 5th, this group of doctoral epidemiologists, PhDs, came up with a case definition that has rocked America. In the bottom of this first page, when they have the background and justification for this case definition, they write, the CSTE, the Council for State and Territorial Epidemiologists, none of whom are medical doctors, mind you. They're PhDs, and God bless them for the good work that they can do. But in this statement, they realize that field investigations will involve evaluations of persons with no symptoms, and that these individuals will need to be counted as cases. Why is that? Because at that time, back in April, there was this incredible fear that every man, woman, and child in America was potentially able of infecting every other man, woman, and child in America and leading to their premature demise because they may, God forbid, have COVID-19 in their respiratory tracts. Well, if you've watched any of my previous videos, you now understand that it is virtually impossible for an asymptomatic individual who has not been exposed right in the previous couple of days to a sick individual, meaning that they may be pre-symptomatic, right? They've spent 15 minutes with a sick person and they're starting to feel a little fluish, a little feverish, but maybe they don't have the full symptoms, and then they go and spend hours with somebody else. Yeah, that has been known to happen. But perfectly healthy children and young adults and older adults have not been transmitting this to others in churches and at sporting events and in the schools and in the workplaces. That's our problem. Instead of taking the quarantine approach, which is early identification and isolation of sick people, which is how we managed every other infectious disease, and this disease, we turned it completely around. We took the advice from the northern Italian doctors of keeping everybody at home that was sick. Okay, northern Italy had an epidemic, and the doctors realized, get them out, keep them out of the hospitals, and get them to stay home and treat them at home. Many of them did just fine. 95% of them do fine, don't die. But what do we do in this country? Instead of keeping the sick people at home under quarantine, we told all the healthy people, stay at home. And we scared the heck out of them now by having all these new cases based on this case definition, which allows us to proclaim that there's a new case if a person's never been sick and all they have is laboratory evidence, either through the nasopharyngeal swab or through the serological evidence from the blood. One looks for the actual protein, the antigen, the viral particles that cause the disease. The other in the blood looks for the antibodies, our immune response to that disease, which is in fact a healthy response. And we're calling those persons cases as though they're sick persons. One local hospital even has the audacity to put the term patients. Oh, we've got 2,000 new patients in the state of Florida. Oh, they're not patients at all. They're home, watching television and driving to the grocery store. They happen to have evidence of immunity, which we're defining as cases. So yes, this is what this Council of State and Territorial Epidemiologists did. They said all you needed was the lab test alone, or get a load of this, you could actually give someone a definition of a case. You can define them as a new case if they have, and here's the document, it's pretty incredible that we just check the boxes. You can have at least 2 of the following symptoms: fever, chills, rigors, myalgia, body ache, headache, sore throat, along with a cough. Those symptoms along with what they call epidemiologic linkage evidence, which is simply that they could have had close contact with anybody with a clinically compatible illness, or anybody who said, oh, I had COVID, or I was exposed to COVID, or they're a member of a risk cohort, which could be that they're in a nursing home, or they're over 70. This has become a nightmare from my perspective, and it's a boondoggle as far as I'm concerned for those who in the media would have us believe that the case numbers of sick, infected people are going up, up, and up. When anybody who has a fever and a cough and has any association with these cohort groups, or perhaps traveled to New York or any other hot spot, and they love this term hot spot. You can have a hot spot because of cases of healthy people, and nobody's sick, but it's a hot spot because so many people got tested. So right now we have thousands of people who have been given the diagnosis of COVID-19, new cases based on no sickness whatsoever, in the case of lab testing, or mild symptoms that could be influenza or any other virus, adenovirus, echovirus, or any other coronavirus, and now they're COVID-19. And by the way, secondly, the number of deaths, and I've shared this previously, you don't even have to be sick with COVID-19 to have COVID-19 on your death certificate. If that person, hours before they died from heart disease or kidney disease, had a rapid COVID test, come back positive in the hospital, that's a contributing cause on the death certificate. We have those directions to put that in. And if COVID-19 is a contributing cause, meaning if it's present at all, then it goes down as the cause of death for the purposes of these epidemiologists and the Centers for Disease Control. And that should concern all of us. If a patient in a nursing home dies from pneumonia, these are directives from the CDC, and does not have a proven cause, meaning we haven't done any other blood work or we can't find another bacterial pathogen, another viral pathogen, then it is COVID-19 until proven otherwise, and those are going down as deaths from COVID-19. So please, when you look at the new cases and you look at the deaths, take a deep breath, take a step backward. You know, we have been so busy for the last 3 months in this country, it seems to me, trying not to die and forgetting how to live. And that is why I started these videos. When they took the hoops off the backboards for my 11-year-old not to be able to play basketball, and they told all of us we couldn't go out and ride bikes and play tennis, we couldn't congregate anymore in churches, and all the other things we've been dealing with, we couldn't go to the funerals, people couldn't come to the hospitals to visit their loved ones. I've spoken about this. All of this was based on an artificial definition as to what a case of COVID-19 is. And I am not convinced that these epidemiologists didn't have another motive when they came up with this case definition. And maybe someone will prove me wrong, but why the heck didn't we go back and look at H1N1 and look at Ebola and look at other infectious diseases that were very concerning for everybody, and use those case definitions, measles and malaria and tuberculosis. So I'm trying to not make these very long, but you understand that I've done a lot of homework on this, and you have to appreciate that the doctors, my fellow doctors, don't even want to hear this from me. I brought it up at a medical staff meeting, you could hear a pin drop. Nobody wants to recognize that we physicians have been getting our marching orders from agencies that are not even headed up necessarily by physicians, that have other agendas. So when they tell us that we have to wear masks everywhere in a hospital because it makes the patients feel better to see us with masks, it gives them a sense of reassurance that we care about them, when in fact I cannot get COVID-19 in the hallway in a hospital. And I can't get it as well walking through the stores, and neither can you. But somehow the restaurant, I feel so bad, as you should, for the waiters and other restaurant workers who have to wear not only the masks, but the gloves when they can't be doing anything to give us the disease in those settings. All right? We've done all this. I realize some of you still are concerned that asymptomatic people can get you sick, but I'm going to tell you what, you need to stop worrying. When the World Health Organization came out, one of their spokespersons, and said that she was castigated, as many people have, just by providing the evidence. All right? In fact, COVID-19 does not exist in the atmosphere. It exists in the respiratory tracts of infected persons. And as we're seeing, many, if not most, and certainly most, of these persons have been asymptomatic and now developed adequate immune responses and are no longer contagious. So we're talking about a small minority, and in my own community, virtually no people that are contagious right now, that are sick and able to give us enough of a dose to keep us sick. You know, it's this fear that's driving all of us crazy. And I recall my mother gave me a record years ago of all of the famous radio broadcasts of the 1930s, and I used to love to listen to it as a young boy. And I'll never forget listening to the radio broadcast of Franklin Delano Roosevelt's inaugural address in 1933, in which he said, "We have nothing to fear but fear itself." And I thought about that in anticipation of this video tonight, and I said, no, you know what? We do have to fear, rather than fear itself, we have to fear those who would have us fear COVID-19. I am deathly afraid of what is happening to our country, that we so willingly surrendered so many basic freedoms 3 months ago in the absence of any medical, objective, scientific justification. Which state is it that has as its motto, live free or die? I would appeal to you, it's time for us all to live free and not worry about dying. Trust only those who are willing to give you objective data that is not biased by other agendas, political or economic or otherwise. I thank you for listening to this. God bless you. Have a blessed night.